Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Welcome back.
Welcome back. That's
Welcome back, Dr. Ayala.
Thank you.
What a great show.
Yeah,
See, he's taking over. He's taking over already.
No, well, for today.
He's taking over.
For today.
No, I'm not.
But we
Dr.
talked
Ayala
about,
is like Ina when she came. She was like,
yeah, I know, that's right. Once they get it.
Ina, give me the microphone.
That's right. Now we have to take the microphone away. But I was very impressed with the calcium score, Dr. Ayala. Really, I didn't know that was even possible. Because I don't take statins or anything, but I've always heard that that's not a really good thing to do. And so your explanation was excellent.
Well, the question, I guess, and I want to ask you because people go to their primary care doctors, and sometimes the primary care doctor have no idea. And instead of saying, go and ask Dr. Ayala because I really don't know the answer, they might come with some wishy-washy answer. If I'm going to do this, I know that if I go to a cardiologist, they want to do a stress test. They want to do a thallium stress test, nuclear medicine testing. Where do you position this study that has been done? Since, you as a cardiologist, I mean, you are an ideal person to be doing this. Your specialty here, the combination of your two specialties is worth gold. Because a lot of people are doing the cardiovascular CT, and they are radiologists. And, my heart go out to them because I know some of them are fellowship trained and what have you. But you are a cardiologist doing this test. So what a better person.
That's unusual, huh?
That's very unusual. So where would you place Dr. Ayala, since you can carry both hats, the cardiologist hat and the imaging physician here? Where will you place this?
That's another great question. So I'm being bombarded by great questions.
We're going to need 2 more hours. I can see this.
Well, let me clarify one thing. When we're talking about calcium score, it's a CAT scan of the heart without dye. That's number one. And it is a screening tool. Screening means that patients don't need to they don't need to have symptoms in order to have this test. So if somebody comes with risk factors and they go to the doctor's office and the risk calculator falls, let's say at 10, and they're recommended to go into statins. But like I said, some of these people may not have the disease, in which, those people, the question is, do you really want to give statins to somebody that does not have the disease? So this is something that is good for the people that don't have symptoms and have risk factors, and they may be considered taking statins. Now, a different category is when you do a CT scan of the heart for people that have symptoms, that are now coming to your office and saying, "Doctor, I'm having chest pain." Now, this is a breakthrough also for the CT community. There's a study that came out like a year or so ago called the PROMISE trial. It was an American trial that was done in many places all over the country, in which people came with chest pains to the doctor's office, and they went and have a stress test, nuclear stress test, or had a CAT scan of the heart. And the reason why this test was done, it was in order to try to find out which one was better. Because some people were saying the CAT scan is better, or some people were saying, the stress test is better because it's a functional study and we've been doing this for years and years. So, but the premise of the study was that, CAT scan was going to be probably better. And what happens is very interesting. The study showed, at least the way it came out with all the data, is that it was a tie. Neither of them we would say that it was overwhelmingly better than the other one. So people jumped and said, "Oh, CT scan lost." So, but I have to say this: it's probably the best loss that CAT scan community could have ever had, and the reason is simple. Until that point, CAT scan was like a second category citizen. Yeah, it is there, but nobody would dare to use it, and it wouldn't be in the major talks because it was investigational. Insurance companies were not paying it. I've been doing this for years and years, and the biggest obstacle was the insurance companies would deny it. So how many people can afford to pay this out of their pocket? So it was the biggest win that the CT scan of the heart ever got, because now, these days, the insurance companies are paying a lot more times. And the doctor, cardiologist, or whoever, when it comes to patient with chest pains, now he has the capability of saying, "Oh, I can do stress tests, but also at the same time, I can do a CT scan of the heart as the first test," which is a major thing. Before, it was something delegated to maybe later on with other tests have been done, maybe to do CT angiogram of the heart.
But let me just ask, as a patient, I mean, if I were a potential patient, and Dr. Mencia, as well as Dr. Ayala, please answer this. Going through a stress test, I've heard, is very stressful to do that people worry. And the CT scan is probably not. You lie down
it's very scary.
Yeah.
It's
so that's my question.
Yes. And a lot of people don't even want to do the stress test because they feel, And I saw one of my patients with the blood pressure, usually very normal blood pressure, doing well. And he see one of those cardiologists that don't like to communicate with the primary care.
Oh, great.
So I noticed the blood pressure, the systolic blood pressure, which is the top number, up by 28 points. And I say, "Oh, my God, you okay? Any chest pain?" I say, "I'm stressed out." "Why are you stressed out? What's going on?" "Well, my cardiologist want to put me for a stress test. He never done it before. And I don't know because he just got the machine. So I don't know if he's doing it because he's going to pay for that machine. Or do I need a stress test?" And I'm freaking out. And I say, "Well, you have rights. You have the right to talk to the cardiologist that you want more information. And you want to know what is the indication, why he want to do it on you. So just call and cancel the test, first of all. Cancel the test, make an appointment with your cardiologist, confront your cardiologist, and talk it out, And one of the things that I always try to tell my patient, Dr. Ayala, is that you are a consumer of healthcare. And as a consumer, we all have rights. I have patients that come to me and say, "I don't want to do any blood test." I have one young guy that came to me. "I don't want to do it," with good insurance. So it wasn't money. I know it wasn't money. And I said, "Well, this guy could have his head on the sand and don't want to see anything." But he was very interested in vitamins and other things. And I said, "Okay, I'll treat you." And I just documented patient decline, any type of workup, but want to talk to me about vitamins and what have you. And he listened to us on the radio. He probably listening to us. And I said, "Okay, well, I'll do what you want. This is your desire. This is how you want to be managed. If it's me, no, I do my blood test. I want to know what's going on." I just went through the calculator. And because this is pencil talk beside the wonderful well awareness. If you Google cardiovascular risk calculator, you Google that first, you're going to see a bunch of stuff there. It's going to say
cardiovascular risk
calculator.
Okay.
So you go there and remember, when you Google anything, the first thing that is going to pop up is not usually the best thing.
They just pay money to get it there, right?
Who is paying more money to get on top? And that's what people don't understand when they're using. So once you do that, you go to one, and you can correct me if I'm wrong. There's one that say ACC/AHA AS C as in Charlie, V as in Victor, D as in Delta, risk calculator. You tap on that one, and then you put all your information. ACC, A Charlie Charlie, / AHA, AS as in Sam, C as in Charlie, V as in Victor, D as in Delta, and then you tap on that one, and I just did that, and it say heart risk calculator, and it asks you for your age. And if you notice the age, they go from 20-year-old to 79 years old. Then it asks you for your gender, your race, your total cholesterol, your HDL, your systolic blood pressure. Don't lie about it, please. Your diastolic blood pressure. Are you being treated for high blood pressure? Are you being treated for diabetes? Are you a smoker? Now, for the diabetes part, I want to remind our audience that if you are being told that you are borderline diabetic or that you are a diabetic, that you are very well controlled with diet is a form of treatment because you are not taking metformin or other medication. That does not make you a non-diabetic. You're still a diabetic by gene. So if you have been told about being a diabetic, click on yes. Don't say no. Go ahead, doctor.
Oh, wait. Why
So
is
then
it
you
just
go
to
and
79? Wait, why does it just go
That's
20
for
to
Dr.
79?
Ayala. 20, that's,
Okay, let our poor 85 and 90-year-olds.
Yeah, well, when you go to that range, you just put the higher age bracket.
Oh, I can answer that one. I can answer that. You know who taught me that? My grandfather.
No, what?
Because
what?
Dr. Ayala, when I was in medical school, I go to my grandfather. He died at 109. But, he was 106 when I was going through medical school. And I first, with learning all about the heart and what have you, and what is an electrocardiogram, and what is an echocardiogram, and all this excitement stuff, how the heart works, and the calcium and the magnesium. And I'm so bombarded. And then we learned that you had to take an aspirin. You had to take at least a baby aspirin. So I go to Grandpa. I say, Grandpa, you have to take a baby aspirin. He goes, you are not. You're crazy. I take an aspirin if I get a headache. I said, no, Grandpa, we want you to live long. Please, take a baby aspirin. The professor says so. So he refuses. You don't know what you're talking about. Bring the professor to me. I will teach him. So I go back to the professor and I say, my grandfather refuses to take a baby aspirin. He said, well, he should, but how old is he? I say, 106. He said, oh, please, no. He has the gene already. That's for those people that don't know. So I guess that's what 79.
Oh, that's
once you go beyond that, then you have.
Yeah, that's the story. Okay.
Once you go beyond certain age, your risk is the same. If you're 70, over 75, than over 85. Right. So it's just.
I'm getting close. Okay,
so where we place? We were placing the city, the cardiovascular city with all these stress tests, and we spoke about the benefit of the calcium score. Before Dr. Ayala, he's very involved with something called transaortic valve replacement.
That's what the TAVR is. No, wait, before we do that, I better if people really want to talk to you, I'm going to give your phone number out. It's 954. Remember, as Dr. Mencia said, it's Pencil Talk Radio. Get your pencils out. This is 954-772-8000. That's an easy number to remember. 954-772-8000. He's located in Fort Lauderdale. And it's the MR Scan and Imaging Center. Ayala is spelled Ayala. So Dr. Ayala is there. And, okay, you can continue now with TAVR. We call it TAVR. TAVR.
Yeah, and if you forget his name when you go to the
Mencia.
center, if you forget his name, just say, oh, the handsome cardiologist that you guys have, because he's the only one.
Well, I want to clarify something. One of the reasons that I am there is because it's a place where they have taken the technology to a different level. In other words, we have the equipment that is the latest in every way: MRI and CAT scan and ultrasound, and even in PET scan. I'm also involved occasionally in doing PET scans for the heart, which is a higher level than the regular thallium and so on. But I have to mention that when you want to have this test done, they have to become referred by a physician.
Dr. Mencia.
And that's where I put Dr. Mencia.
Of course.
He needs to, like I said, they need to see the whole person. They cannot just come and say, Dr. Ayala, can you do this test for me? Because I need to relate to another physician that takes care of the whole patient.
And also you want a physician that understand what are the data that you're going to need when that patient comes to see you, because it's not the imaging. They're getting the doctor that specializes in the heart and who is going to be reading the test at the same time. So you need, as a clinician, you're going to need those data to better help that person.
But wait. Then the good thing is that you speak to the patients after. See, this happens a lot of times. They go and they have these tests, and then there's no one there to tell them. But Dr. Mencia is so good about this. He's really the captain. He's the conductor of the orchestra. And I'm starting to do what you do, right?
Yes.
I got this thing.
That's the orchestra.
The orchestra. And so
it is very true. It is very true. There's no benefit to the patient if this test is done and falls in nobody's hand and nobody has a follow-up into this.
And, Dr. Kagan, the medical director, had done such a great job in making a place of dignity. I mean, he had really upgraded this center. You should go there and take a look.
Place of dignity. I like that.
Because you go to some of these places in the hospital. I remember when my younger brother was diagnosed with an aneurysm of the brain and he died. And I said, well, knowing the risk factor, I better go and get an MRA just to get checked. My younger brother. And I have, of course, no symptom. I live a healthy life, so did he. Went to the emergency room twice, was turned back and said, you're probably under a lot of stress. That's why you're getting a headache that you never had before. So I went to one of those famous hospitals. You mentioned one of them just now, that I went and sat down for hours. And I went with short, my hair down, T-shirt, and I'm sitting there waiting for an MRA. Until one of the staff recognized me and said, are you Dr. Mencia? I said, yes. I am here waiting for an MRA for the past 3.5 hours. And everybody go, oh my God, Dr. Mencia, we know you, we see all your prescription all the time. And they put me in, and I say, what a care. What a care. I mean, when you go, Dr. Kagan had put something that really is state of the art. Beautiful place, clean place, and the staff are just wonderful.
Do you give tours?
Yeah, we can give tours anytime.
Well, at least I need to have a tour so I can help Dr. Mencia with all that he's doing there. But thank you very much. But I think, equipment's very expensive. And it sounds like they have decided they want to be the state of the art.
Well, image is, as you can, probably imagine, imaging, if it's not good quality, it doesn't serve any purpose either. You see better, you diagnose better, and the benefit is for the patient. A clear diagnosis is of paramount importance. Let me just give you a little example that it happened to myself. I started having hip pains like 4 or 5 years ago, and I had an MRI in the area of Wellington that I was working at that time. And then they couldn't see anything, friends radiologist. So I went to the hospital and had another MRI. And the radiologist there never saw anything either. They say, I don't know, we don't see much, Ivan, I don't know what it is. But I kept having pain and walking and all that stuff. So finally, I went to Bob Kagan and I said, can you try me your new MRI? And he said, of course. And well, this was a 3 Tesla. It's like a little bit comparing like high definition TV to a regular TV. When I had the images, I was able to see myself. I had a tear in my labrum and in one of my hips, and I needed surgery in order to correct it. So imaging is very important to have imaging with the right equipment. Because this is part of a business also. Some people may not have the right equipment, and then they still can do the test, but the quality is extremely important when it relates to imaging.
Absolutely.
It's a very important radio show, because just for no other reason, what has just been said here, is because people go, they don't really know where they're going. But that's why you have to be recommended to the very best. If you're going to go through it, it's not going to cost any more. Medicare, if Medicare is paying for it?
Not only it's
Exactly.
not going to cost, it's not that it's not going to cost anymore. It's that your insurance will pay for the test to be done once. And if you went to a place that has an old machine, still called an MRI, still built the same way, now the only data that the doctors are going to get is the one that machine can produce. So if you go for go for a state of the art X-ray, and I take an X-ray of the shoulder, and I go to a machine that is portable to take an X-ray, the images of those two X-rays are going to be day and night. One is going to be very specific, very detailed, and the other one is going to be kind of blurry, and we can see that there's a bone here and there's a space there, but it's not both the same image. They both get paid the same way.
Okay, well, I don't want to run out of time. There were a couple of things, TAVR. So is that important? Or
Yeah, let me say-
the
let me say-
Watchman. We have Watchman too. Can you
Yeah.
do both?
Yeah,
Or no,
and
just do
in
one?
a few words, first of all, let me clarify about the calcium score. It's a simple test. You don't need to be fasting. You don't get any iodine. You don't get any of that. And it takes 5 minutes to do it. And what happens right now, as we're talking, there's only one place in the country that the insurance companies are paying for calcium score, and that's in Texas, because the governor or someone there almost had died of a heart attack, and he is the one that promoted and obligated in that state the calcium score to be paid. The insurance companies otherwise in the rest of the country pretty much don't cover this. The good news is, though, it only costs $90 to have this test, and I think it's worth it, every penny for it. Mm-hmm. Now, going back to TAVR and Watchman. Watchman is the watch man, and it's let me get started with that quickly. Is a lot of people, over 5 million Americans, have atrial fibrillation. We get commercials about medication, all that stuff in TV. Atrial fibrillation is a heart irregularity that is going to put you at high risk of having a stroke. Right. So when you have that, most of the doctors just prescribe you to take blood thinners like warfarin, or one of the new oral anticoagulants. The problem with that, the compliance to take those medications for years and years is not too good. And people end up after 2 years, the drop rate is significant. So that puts these people into high risk of clots. Well, these days we can put a plug into the area where the heart forms clots, and basically you are left with no need to take oral anticoagulant.
The small chamber called the atrium.
It's the left atrium, but within the left atrium, there's a pocket that's called left atrial appendage, which has very irregular borders where blood stagnates there. That gets slow flow and forms clots. So this way, you basically go to the hospital, get this procedure done these days that's approved by Medicare, and you are free of having to take anticoagulants that put you at risk for bleeding, other complications.
Is it covered as an alternative to blood thinner,
it's
because the person cannot take
people that are not candidates for or they're at high risk for taking blood thinner?
So if you are one of those patients that are falling alive, you have atrial fibrillation, and that would be a good alternative.
That is an alternative.
Excellent. Very good.
Now, go in a couple of words. I think I may have a minute.
Yeah,
we have a minute. Yeah.
Let me just say a few words of for TAVR. There's an entity called aortic stenosis that affects.
TAVR, that's what people go drinking. No,
not close. No, this is TAVR. It's TAVR. It stands for transaortic valve replacement. Now, this is, in a few words to make it short, is people as we age, we are prone to have calcification of the aortic valve and narrowing of the aortic valve. It's a mechanical problem. Your heart cannot pump out anymore, and then you end up having symptoms, and eventually, if you don't do anything, you die from this condition because medications are not going to help. So it affects many elderly. Over 75, there's a significant amount of people that are walking around with aortic stenosis and not getting any treatment that helps. So those people have to have valve replacement, open their heart, their chest, and have an aortic valve replaced if they want to do better. But these days, in certain people that are high risk, that they cannot take the surgery, there's an option that's called TAVR. What TAVR means is that we put a valve through the femoral artery, like a catheterization.
Through the groin.
And through the groin, and we deploy a valve there where the narrowing is. All of a sudden, you have a new valve working in a few minutes, and you leave the hospital, in 24, 48 hours.
And that's fabulous. And I have to tell you, we're running out of time, but I have to give the number for Dr. Mencia. Be sure to call the office. They're open Saturdays, 954-489-1345. That's the commercial Fort Lauderdale address, and they do take care of homebound patients. Their website is agifl.com. Dr. Ayala, it was wonderful having you here. Dr. Mencia is so thrilled. I can see it. And we'll be back.
I want a second from Richard before we go, because we're starting a program this summer, and it's called Help Me Smile. So if you need implants, if you need any kind of dental implants, if you go to a dentist, they give you a proposal, what it will cost you. We will help you with that proposal. We will cut it down by 50%, whatever it will take to help people with that need either denture as implant, or they need a tooth that they lost is in the front, to help them smile. And we're going to do a show on that.
I love that.
Smile.
Okay.